Hey, are you losing your vision? Stay tuned. We're going to try and figure out one of the things that might be causing vision loss. Welcome to Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Wiening.
And I'm Dr. Rajiv Bindlish, an ophthalmologist in Oakville.
We got an eye doctor here to help us out. And what condition are you going to be discussing today?
So we're going to be discussing macular degeneration, one of the leading causes of blindness in the developed world.
Macular degeneration.
Okay, what is it?
So macular degeneration is an aging change of the macula. The macula is the center part of the retina, which helps you do fine detailed vision. So it helps you read small print, it helps you thread a needle, and it's very important for your eyesight. In macular degeneration, you get some aging change in that area, and that can eventually lead to central vision blindness.
Aging, that word scares us all.
Yeah.
What do you mean by aging?
So it's an accelerated process where you develop a buildup of protein and lipofuscin type products underneath the fovea in the retinal pigment epithelial cells of the macula. Complicated, but generally it's just a very bad type of aging change that some people start to get in their 40s or 50s.
I need numbers because the definition of older is anyone older than me. The definition of younger is anyone younger than me. What is the number?
So again, typically macular degeneration, where it affects your vision, typically happens in people more in their 70s and 80s. Unfortunately, some people start to show the precursors to macular degeneration in their 40s and 50s. A strong family history unfortunately puts you at risk.
What about gender, race, other medical factors?
Generally, it's not males and females are relatively equal. There are no specific genetic factors other than just your family history. It affects all races.
Yep.
All
No one's
right.
spared.
It's in
No
your
one's
genes.
spared. It's in your genes.
Kind of.
Okay, so I'm developing macular degeneration. What am I going to notice? How am I going to show up to my family doctor?
So again, many times early on with macular degeneration, it's just picked up on a routine eye exam. You just go in to see your optometrist, or you go to your family doctor saying that your vision's a little bit blurry, and that causes you to get an eye examination. And during the eye examination, we start to pick up changes in the macula, whether by looking or taking a photograph.
So typically like fundoscopic exam where they're looking
Fundoscopic.
deep into the back of your eye.
Deep into the back of the eye, exactly.
Okay.
And then from there, we can do more sophisticated testing, such as an ocular coherence tomography, so an OCT, which is a fancy X-ray, and can look at the specific layers of the macula.
Okay.
Okay, so I've had some vision changes. I went to see the doctor and I've received the unfortunate news that I've got some signs of macular degeneration.
So early macular degeneration actually really doesn't overly affect your vision, and that's the good news. And when you get that diagnosis, it's not a bad diagnosis, but it's a wake-up call for you. Some things that you can do to lower your risk of macular degeneration: live a very good, healthy lifestyle. So diet, exercise, taking multivitamins, a good diet of leafy green vegetables, wearing sunglasses, so UV protection is very important, and then getting your eyes checked regularly.
You did not mention chicken wings in that diet. How do they play a role with...
So again, we don't have any direct correlation of poor health status, but generally those people with more advanced disease were less likely to have take leafy green vegetables or take multivitamins.
Just like
So,
basic advice that your parents told you when you were growing up. Your
exactly,
grandparents.
eat your vegetables.
Kale, eat it. We tell you every single episode, and Paul wants it to be chicken wings, but it's not.
Kale, the cardboard food that we all love.
Chicken wings are good for your stomach, not good for your heart, and may not be good for your eyes.
Okay. So you've got an early macular degeneration, some lifestyle things you can do to help slow that progression.
So again, just wearing sunglasses. We sometimes will give you something called an Amsler grid. So it's like a piece of graph paper you tape to your fridge. You want to make sure the lines look straight. And then we usually say take some multivitamins. So a broad-based multivitamin and then some specific eye multivitamins. And these have a component called lutein and zeaxanthin. And those have been shown to possibly slow the worsening of macular degeneration.
Quick note about the sunglasses. Would you tell everybody that the average person should be wearing sunglasses when they're outside?
Yes, and this should start in your teenage
Right?
years.
I mean, because it's underdone by people.
It is.
And that is because of the ultraviolet light causing harm.
Exactly.
Okay, and then one thing I was always worried about was when you're wearing sunglasses, that they don't totally cover your eyes, and you're still getting a lot of sun in from the sides. Could that be more dangerous?
That's a little bit controversial. You mean, some people do like the wraparounds because they don't want any light getting into your eye. I think just any pair of glasses, because most glasses will filter out 98% of UV light.
Okay.
I think the wraparounds look cool.
Yeah. Good for biking.
Yeah, good for biking. So now you got your sunglasses, you changed your diet a little bit, you're taking some multivitamins, still progressing, and now your vision's a problem for you. What's our next step? What's our treatment options?
So first we have to decide what type of macular degeneration you
Okay.
have, if you have the dry form or the wet form. In terms of the dry form, currently there is no available treatments other than the multivitamins and the UV protection. There is some medicine on the horizon. It's called Complement. It is an injection into the eye. It's just recently got FDA approval, but we're waiting to hear more studies and approval in Canada. If you have some very sudden vision changes, that could mean wet macular degeneration. The good news for wet macular degeneration, there are a number of treatments that are available. These are injections of medicine into your eye. We call them anti-VEGF, and there's currently 3 available. And these are monthly injections, and these monthly injections help shrink the blood vessels that cause the vision loss.
Right. And it's called wet because is your eye actually wet?
Well, it's wet because there's blood vessels and there's swelling and leakage.
So it's
of
wet
fluid.
on the inside,
Wet
a little
on
bit
the
on the
inside,
As opposed to the rain, Dr. Rena.
Yeah, exactly.
Okay, so that's macular degeneration.
Now, when you have that treatment, so say you have the dry, it's progressive, there's no real treatment. So is it typically just a slowly progressive disorder? And unfortunately, some people after 20 years might completely lose their vision.
In the dry form, it means very slowly over time you get atrophy of the retinal pigment epithelium under the macula. And all of a sudden, you could go a long time without any problem, and then the 1 year, it kind of hits right in the middle, and then you could get a sudden decrease. But generally a slow process. The wet form is a little bit more immediate.
Yeah.
So you might be going along, but you check with the Amsler grid, and all of a sudden you start to notice some distortion. Get into your eye care practitioner right away, and the faster we institute the injections, the better the outcome.
So if I see what you're saying here, there's no cure, but there are some things we can do to slow down the progression.
Slow down the progression, and those are these injections of anti-VEGF medications.
That is a great summary of macular degeneration. It just reinforces what we've talked about on our channel over and over. Take care of yourself. So eat right, exercise, wear your sunglasses, take your vitamins, and see your doctor on a regular basis. One of the ringing themes of your care is regular visits to the doctor to make sure you're on top of these things before they become a big problem.
Exactly.
And if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
And thanks to Dr. Bindlish for joining us again.
Have a nice day.